Ladies and gentlemen, I'd like to talk to you about personalized medicine or pharmacogenomics. Personalized medicine or pharmacogenomics utilizes information about a person's genetic makeup to tailor strategies for the detection, treatment, or prevention of disease. For example, hereditary breast cancer. In personalized medicine, companion diagnostic and follow-up therapeutics utilize molecular analysis technologies to diagnose and manage a patient's disease or predisposition toward a disease. The goal of pharmacogenetics is to prescribe a therapeutic plan that is tailored to an individual's genetics and environmental profile. Several significant obstacles confront the incorporation of personalized medicine into everyday clinical practice, including concerns about the age, the use of genetic information by insurance companies to stigmatize individuals, that's genetic profiling, the scientific validity of the data, and the cost and benefit. The pace at which pharmacogenomics is becoming a part of medicine is slow. However, not employing pharmacogenomic testing raises ethical, legal, and regulatory issues and poses a significant risk of liability, which conceivably could hasten the adoption of personalized medicine. In 2010, 11 years after the Institute of Medicine published To Err is Human, the Inspector General for the U.S. Department of Health and Human Services, Daniel Levinson, published an article entitled Medical Mistakes Plague Medicare Patients. The Health and Human Services conducted a study in response to a congressional mandate to determine the number of medical events that were adverse experienced by Medicare patients and the cost to taxpayers. Physician reviewers reviewed a random sample of 780 Medicare patients' charts around the country during the month of October 2008. The results showed that a disturbing number of hospitalized patients are still enduring harmful consequences of medical care. 42% of them were preventable. These instances, which the report calls adverse events, included infections, surgical complications, and medication errors. The study estimated that 134,000 hospitalized Medicare beneficiaries have experienced harm from medical care in 1 month, and the event contributed to death for 1.5% of those, which is approximately 15,000 Medicare deaths monthly due to medical error. These stunning statistics suggest that medical error is the third leading cause of death in the United States, surpassed only by heart disease and cancer. The side effects from prescription drugs alone cause the death of over 100,000 Americans every year. Some of these deaths can be prevented by the use of genetic testing. Individuals that develop side effects are increasingly likely to bring lawsuits alleging that they have a polymorphism or a biomarker conferring susceptibility to the drug that should have been identified and used to alter their drug treatment. Drug manufacturers, health insurers, and pharmacists may be exposed to some liability risks for failing to recognize and do genetic testing or prescribing them. Such lawsuits have been filed against drug manufacturers And one of their defenses is the learned intermediary doctrine, thereby blaming the physician. Physicians lack the legal defenses available to other parties in this class of litigation. The more vulnerable physicians have not received the treatment or the education about genetics, and they are at higher risk for lawsuits, and they would allege that their physicians have not done the genetic test before they prescribe the medications. And therefore, the doctor could not discover their vulnerabilities. So, the doctor may fail to recommend or perform the genetic tests, perform the test negligently, or failed to interpret and communicate the test results appropriately to the patient. Therefore, physicians, manufacturers, and other healthcare providers should be mindful of what I've already mentioned and begin to protect themselves against the liability risks of personalized medicine by making alterations in their practices aimed at appropriately accommodating personalized medicine. And attorneys representing physicians in pharmacogenomic lawsuits have also begun to prepare for defending such lawsuits. Thank you.